manager at the World Diabetes Foundation in our Digital Health Solutions unit. And I have the pleasure of presenting to you some slides, a presentation in this session on facing the diabetes challenge with data registries, integrated care models, and digitization. So I believe we should have a thing or two to say about that, given that we at the World Diabetes Foundation have been investing in digital health. I have about four slides to show today. It's a quick session, so I'm going to run through my slides. The reason that the slide deck that you're seeing now says Diabetes Compass is because we have a very big program that we're doing, a global digital health program at the World Diabetes Foundation. And one of our implementation countries is Sri Lanka. So I work in my daily job. I have quite a lot to do with Sri Lanka, a lot of our local stakeholders there. One of them also being the Sri Lanka College of Endocrinologists that I have the pleasure of working with. So I will use our program, the Diabetes Compass program, to exemplify and illustrate how we work with digital health in the World Diabetes Foundation, and also show you some specific products that we're developing and that we aim to launch in Sri Lanka. So IBE1 to this presentation, and I look forward to running it through with you. So to start with, let me just try to paint a broader picture in terms of digital health and where we believe things are heading and going, which is really controlling how we are developing our solutions and how we work with our partners. So it's important for us that in the world today and where digital health is heading, the journey that it's on, that we think beyond enhancing health systems through the introduction of individual digital technologies. So if we look, I'll try and highlight it. So if we look, for example, the diagram below, we'll see that this painting here, this illustration on the left side, really shows individual technologies being deployed, if you like. And what we want to try and do is really to move towards a more integrated or holistic landscape. And there are really three keywords for this digital health future. The first one is that it should be equitable. So it means that it should be easy to use and affordable to access for everyone. So again, we can think of from healthcare workers in doing their daily jobs all the way to the top level at the ministry, and how they approach the selection of technologies. And these three drivers are really tied together. The second one is that it must be inclusive. In using a more technology-related term, is that it must be open source, meaning that it must be cost-friendly or low cost, meaning also that it should not be dependent on specific vendor technologies. That's an important thing. So inclusiveness is many things, but this is a very strong one. And thirdly, of course, it must be sustainable. While this can mean many different things, again, of course, cost efficiency is strongly tied to the concept of sustainability. Again, from a technology standpoint, it's very, very important that any future digital health solutions are interoperable. I think many now must have stumbled into that term, interoperability. Because it really promotes again that things can be integrated, and it can have a more long-term life in a health system. So at a broader level, these three drivers are things that we really look out for when we try to see the fit for digital health products in low and middle income countries. The next slide will take a look at some of the opportunities for innovation and product development when it comes to digital health. Now we looked at the drivers. They can sometimes be a little bit abstract, but for us in the work we do, they provide a very important guidance at a higher level. If we take one step closer to the actual products that could be interesting to launch and how we can use the technology, supported by those three principles, we need to undergo a process of problem understanding. We decided to focus on health information as a driver for digital health product development. And when we say problem understanding in the context of health information, we identified 4 areas of particular interest. The first one was surveillance. So disease surveillance we have discovered in the countries where we work, it can be difficult to achieve timeliness. So what that means is that for disease surveillance to have an impact for the decision makers, it needs to be somewhat timely. Of course, also consistency and completeness are important factors. So it's not just timeliness. And as a whole, surveillance and disease surveillance in the context of health information is an area that we identified with a lot of potential. And I will come back to it in the next slide. We'll take a closer look at some of the concepts that touches upon these problem areas. The second one was quality. So quality, of course, is key in the delivery of health services. And again, if we look at health information and the ability to use data and to have more data-driven decision-making or data-driven insights, that can play a massive role in improving quality of care. So to be specific, the ability for a clinic or for a particular health worker to understand how many foot examinations are we doing, what's the risk stratification of the clinic population. All these kind of things are able to provide more data-driven insights, which again can be used to improve quality of care. The third one ties a lot to the second one on quality, is resourcing. It's a bit more tangible in the sense that resourcing in this context can dramatically improve the allocation of resources to meet service goals. Very specific example again could be anything related to the storing and stocking of drugs or other types of materials that are needed to deliver care. So resourcing and the connection between resourcing and the ability to have better data at hand is also a really interesting area. And the fourth one, probably the most difficult one to address, is continuity. Continuity in this context could be, in the context of Sri Lanka, could be, for example, the ability to chart patients across visits, or chart the history of patients across visits. You could also imagine that it could go a long way back. So again, as we're addressing chronic care patients, the ability to see a patient's history over multiple years, and even also across multiple facilities, could really play a significant role in the ability to deliver care to that particular patient and to manage that case. So continuity is also a really, really interesting area to look into. In the next slide, we'll take a closer look at how WDF and our partners in our different implementation countries, also in Sri Lanka, are tackling these 4 different areas. So I've made a small slide here which looks a bit busy, but what it really tries to do is that it ties the first 2 slides with the thinking back at how a broader systems approach, trying to have a more holistic or integrated approach, and then using the problems that we just looked at, tying those 2 together to structure an approach that we have been using to guide our product development. So what this slide shows is that it shows a set of integrated digital products to strengthen the NCD-related health information. And while we use diabetes and hypertension as the focal point for this digital transformation, the aim is really to advance the vision of an integrated patient-centric approach to health service delivery. So those are a lot of busy word sentences, but if I try to quickly take you through what happens from the left side all the way to the right side, what we're trying to do is that we have this community data capture, which I'll show you in a second in the next slide, which is really just an app. It's an ability to perform screenings with an easy-to-use app. We also call this a community health platform because we don't only see that this can be used for NCD-related screenings. It could also be used in other types of health pillars. So it's really a community health platform. What it does in this particular journey is that it allows using this app. It allows the people that are screening the individuals at household level to do a referral to, in this case in Sri Lanka, to a healthy lifestyle center, and ultimately, if the screening at the healthy lifestyle center shows that a patient must be referred to a medical clinic, they will be done. They will be referred. And at the medical clinic, the technology that's used, already there are some systems in place now, but we have identified that we can significantly improve the specific management of diabetes and hypertension patients with a clinic module. This is across all countries. So there is a diabetes and hypertension specific EMR module that's introduced at the facility level. After this, the data is transferred, potentially also into what's called a shared electronic health record. Again, this is a concept that we're working on in Sri Lanka. So what that means is that you have we're promoting the whole continuity of care. So this is a health record that's not just residing in the specific facility, but it's a as it says, it's a shared electronic health record. So conceptually, it can be accessed by other health facilities, and also hopefully one day, without over-promising, it's a concept that promotes also the ability for private healthcare providers to access the health information. But that would not be in the now, that's in the future. Once you have the data stored in this shared electronic health record, it's now possible to aggregate it into what could be called an NCD aggregated data warehouse. It's another way of expressing a consolidated data set, or a registry, if you like, where certain stakeholders, either at the facility level or at a regional level or at a national level, can interpret the data, so they can do visualizations and reports and so on. And then lastly, of course, we have the ability for certain users to now use this aggregated data, use it to improve care and create policies and so on. So what this journey does is that it shows really that we're not just introducing an individual technology. We're thinking in a broader sense. We're thinking all the way from early detection at the community to having people being referred to a facility or a clinic, needs be enrolled into care, much better follow-up management. I'll address that in my next slide, and ultimately be able to aggregate the data, use it for analytics and use it for decision making, use it to support indicators that can really support resource allocation or quality of care improvements. So I think if we think back at the four problem areas that we saw in the previous slide, we really tried to address the problems that we understood using digital health technology. In the next slide, and my final slide, I will show you a little bit the things we're working on, how it actually looks, and that's my final slide. So here we are at the end. This is the final slide, and I decided to name it "Moving from Concept to Solutions," since I feel that the previous slide with the timeline and the journey of how information moves from the community to the facility to a shared health record to aggregation or visualization, if you like, to use in certain settings, is much more about a process and trying to show, as I also explained, it's a set of integrated products. So what I have on this slide, we specifically are diving into two of the products or two of the concepts that I explained. The first one on the left side is the community health platform. So this is what's called a mock-up, meaning that it's how we intend it to look like. It's how we intend it to look like on an app, on a smartphone. So we envision that it could be maybe a development officer. We're working with development officers through the divisional secretariats. It could also be someone maybe at the MOH office. It could be a public health nursing officer. We're still exploring exactly who would go to the households. It doesn't have to be one specific type of employee, if you like, or person. Since the app is not something that necessarily requires a health worker. It requires training, of course, but minimum training, and it's very easy to use. There are no biological measures being used. It's what's called a questionnaire-based screening. So the app works by asking 5 questions, and through those questions, the app does a calculation, which is based on a data set, a Sri Lankan data set. And it provides the user and the person who's being screened with one out of 2 options. Either you are at risk, and the risk in this case is a probability. So it's a probability of having undiagnosed diabetes or unknown diabetes. So the app doesn't give you any kind of diagnosis. It just tells you whether you are at risk and whether you should be referred to a healthy lifestyle center. And at the healthy lifestyle center, they will conduct a much more thorough assessment and screening. So it really promotes early detection. It really promotes that instead of people having to go to a facility, they will be screened at the community, at the household level, and therefore hopefully picking up on a lot of the cases of unknown diabetes and hypertension. So yeah, to summarize, very easy to use app, very basic. It also, if I had more time, I could go into details, but there is an underlying automation of follow-ups. So if the patient or if the client or the person who's screened does not show up at the Healthy Lifestyle Center, it triggers different automated follow-ups. Like it could be call this patient or call this client that was screened and at risk, send SMS, maybe even go and do another household visit to really encourage the person to go to the Healthy Lifestyle Center. So the app also has a lot of clever inbuilt features. On the right side, we have a more traditional looking system or interface, which is we're working closely with the ICTA and the Ministry of Health in upgrading the current HHMIS system, which has been rolled out quite extensively in Sri Lanka, with a clinic module specific for diabetes and hypertension case management or patient management. So based on lots of interactions with medical officers and endocrinologists, we're at the point now where we have a very interesting prototype, meaning that it's almost ready to be developed, and it's interesting. It's been a really interesting journey because while at the same time it's recognized that introducing a system into a medical clinic that has a very high workload, it will and could potentially slow down the patient flow to start with. What the upside really lies in the ability to do much more rapid record keeping when patients come for future visits. So what we hope that this will do, this module really will promote that the transition from the patient books into a system with much more rapid patient follow-ups, and also once the patient details are in the system, there can be a much more automated approach to reminders. So all the reminders to come for checkups in the future and other types of automations can now be supported with a system, thereby hopefully reducing dramatically also the loss to follow-up. So that's a really interesting innovation as well, and also tries to, or what we aim to do is not just to introduce a system, but to try to use some of all the technologies, for example, on the automation of follow-ups, the automation of reminders to reduce follow-ups. So these are examples of two products that we're currently working on with partners, and we hope that they'll both be launched, or not we hope, they will be launched over the next year. The community health platform will be launched this year for sure, and maybe this year the diabetes and hypertension EMR module, maybe by the end of the year, or otherwise next year, early next year. So thank you so much. I was allocated 15 minutes, and I could see that I was trying to stay within that. Unfortunately, I didn't succeed. So hopefully it was worth your time. And of course, if you have any questions, you are more than welcome to reach out to me. I would be very happy to answer any of your questions by email or other types of correspondences. My contact details can be requested through the Sri Lanka College of Endocrinologists. I'm sure if you ask any of the attendees there, they will be happy to provide my contact details. Otherwise, I thank you very, very much for this invitation. It was a pleasure. I hope to be there in person the next time. And I wish you all a very good conference.